Did you know? Hello, and thank you for taking a moment to learn about your health. As a nurse, I know that hearing a new medical term can feel a little scary, but my goal is to clear up confusion and empower you with knowledge. Let's talk about uterine polyps. Imagine your uterus, the pear-shaped organ in the pelvis, where a baby grows. It has an inner lining called the endometrium. Sometimes this lining overgrows in one spot, forming a finger-like growth. That growth is a uterine polyp. They're usually soft and reddish. They can be as tiny as a sesame seed, or as large as a golf ball. Think of it like a skin tag, but inside the uterus. Some attach by a thin stalk, others have a broad base. Most polyps are benign, which means not cancerous. It's rare for them to be more serious. They're common, especially approaching menopause. You are not alone. Understanding them is the first step. Polyps grow inside the main cavity of the uterus. This is where a fertilized egg would normally implant. When a polyp grows here, it takes up space and can interfere with normal uterine functions. Most polyps stay within the uterus, but rarely, a long-stalked polyp can protrude through the cervix into the vagina. Not common, but possible. Location explains symptoms like irregular bleeding and challenges with getting pregnant. Polyps are different from fibroids. Fibroids grow from muscle in the uterine wall. Polyps grow from the endometrium. This difference changes symptoms and treatment choices. Now you can picture a polyp, a small overgrowth we can manage together. Why did I get this? It's a common question. There isn't one single cause, but we know key contributors. The biggest player is estrogen. It thickens the uterine lining each month. Polyps can grow in response to estrogen. They're more common in certain situations: perimenopause, postmenopause, hormone swings, obesity. Fat cells make estrogen. Some medications like tamoxifen, high blood pressure, and age. Rare under 20, more common in your 30s, 40s, and 50s. Risk isn't destiny. Don't blame yourself. Focus on identification and management. Your body sends signals. Polyps are no exception. The most common sign is a change in bleeding. Periods may become heavy, menorrhagia. You might notice bleeding between periods. Cycles can turn unpredictable. Any change from your normal? Talk to your provider. Bleeding after menopause is a key symptom. Menopause equals 12 months without a period. Any postmenopausal bleeding needs prompt evaluation. Polyps are common and benign, but we must rule out other causes. Consider it a red flag. Don't ignore it. Polyps can contribute to infertility. They may block implantation or hinder sperm. Many women have no symptoms. Polyps are found incidentally. Regular checkups are crucial. Listen to your body and be proactive. You noticed unusual symptoms and saw your doctor. What's next? First, a detailed talk about symptoms and history. We review your cycles, bleeding patterns, pregnancies, and medications. A transvaginal ultrasound is the usual next step. It's simple and well tolerated. It gives a clear picture of the lining. Polyps may appear as a thickened area or distinct mass. Sometimes we add saline to gently expand the cavity. This outlines growths and clarifies size and location. Hysteroscopy uses a thin camera through the cervix to view inside the uterus. We can see polyps in real time and confirm diagnosis. Often we remove the polyp during the same procedure. Diagnosis and treatment done together. Once a polyp is diagnosed, we choose a course of action. You have options. We consider size, your symptoms, age, and pregnancy plans. Small, symptom-free polyps may be watched. We keep an eye with follow-up imaging. If bleeding is heavy, the polyp is large, or fertility is affected, removal helps. The common procedure is hysteroscopic polypectomy. The hysteroscope lets the doctor see and reach the polyp. It's carefully snipped or shaved away. Most go home the same day. Tissue goes to the lab as a standard step. A pathologist confirms it's benign and rules out concerning changes. That confirmation brings peace of mind. Recovery is smooth. Mild cramps or light spotting can happen. Avoid tampons and intercourse briefly while healing. A healthy lifestyle is always a good idea, though there's no magic way to prevent all polyps. Maintain a healthy weight and stay active. Excess fat raises estrogen. Manage blood pressure too. Use medication, diet, and lifestyle changes wisely. Be active in your care. Schedule and attend annual exams. Build a relationship and a health baseline. Speak up about any change. Call if periods become heavier or longer. If you have spotting between periods. If you struggle to conceive. And any bleeding after menopause.
Thank you for watching, for the love and support. And if you haven't already, subscribe.